we look at sort of the pillars, the really important pillars of dentistry. We want to look at the joint, occlusion, muscles, airway, and when we look at TMD or TMJ, we want to look at the craniomandibular connection, and we want to bring forth an understanding of all the systemic health. With that being said, we're looking at aesthetics and function. These are a very typical series of pictures that I take in my office. And if I can bring your attention to, let me see if this works. Here we go. So I'm looking at his distal edge position, his lip at rest, and I'm looking, he's banging on all of his back teeth here. He's got some posterior interferences. I start taking notes. I'm just taking notes. I'm like, okay, I decided to do splint therapy here, and I want to verify the seated condylar position. I want to make sure that we've got a really position or treatment position for him. And we're going to look at doing a trial SMAT. We're going to design the case. And then after the dentistry, we're going to look at some sort of sleep study and sleep appliance therapy. So if I were to summarize from the information, well, his joints are not healthy. He has muscle discomfort. He does not have stable occlusion, and I'm worried about his airway. So in this patient, he's really ready to move on with comprehensive care, and really wants the anterior aesthetics and the form and function that he's looking for, but I'm not comfortable moving forward. Don't know about his joint position. The joints are popping and clicking. His muscles are tender. He's not sleeping well. So I decide here in his case that I'm going to do some splint therapy. Sometimes we want to make sure that the condyles are centered in the fossa. In this case, we want to see if the condyles are distalized. If we've got distalized condyles, there can be more pressure in the posterior lateral pole or the lateral ligaments. So definitely want to make sure that the condyles or the TMJ is in a very good position first. So he's feeling good. We do the splint therapy, and now we're going to go into some aesthetic overlays. In this case, here's a final there. We do lithium disilicate crowns and veneers. And in that lower right picture, he ends up getting a sleep study and a sleep appliance. So sleeping well, doing well, really aesthetically pleased, and feeling comfortable that his joints are stable and occlusion's in the right place. And now we're maintaining the dentistry with a sleep appliance, and he's sleeping great.